With regards to biomarkers, I think that's what I tried to portray in that talk. There's a lot of exciting things, but what is probably what has emerged in the past 2-3 years as probably for me the most exciting new development is the idea of circulating tumor DNA and liquid biopsy in Hodgkin lymphoma. So what we have learned now is that in Hodgkin lymphoma we can really sample the tumor genetics with a very simple liquid biopsy just by drawing blood from a patient. And that is very helpful in Hodgkin lymphoma because getting this kind of genetic information from a tumor biopsy, because the tumor cell content in a typical Hodgkin lymphoma tumor is so low, was very difficult in the past. And we can now use this biomarker technology twofold. We can first use it to understand the genetics of the disease better and maybe identify subgroups of patients that we can treat differently in the future, and some of them maybe less aggressively. But we can also use this to really get a molecular fingerprint of the patient, which we can then follow over the course of the disease and have a really good disease biomarker. And we have seen in the past 2 or 3 years from various groups that this works in Hodgkin lymphoma. And I think what will need to happen in the next years is that this is implemented into prospective clinical trials to see whether it really works to stratify patient treatment.